Selective mutism is an anxiety disorder characterized by an inability to speak in specific social situations, despite having the ability to speak comfortably in other settings. It typically manifests in childhood, often emerging during early school years when children are expected to participate in social interactions. Selective mutism is not a choice or a form of defiance, rather, it's driven by intense anxiety and fear. The exact causes of selective mutism are complex, involving a combination of genetic predisposition, temperament, and environmental factors. There may be a genetic component to selective mutism, with a higher likelihood of this disorder occurring in individuals with a family history of anxiety disorders or shyness. Some children may have an innate predisposition towards anxiety, making them more susceptible to developing selective mutism in response to stressors. And traumatic experiences, such as bullying, family conflict, or significant life changes, can trigger or exacerbate selective mutism in susceptible individuals. The primary symptom of selective mutism is an inability to speak in certain social situations, despite speaking fluently in other contexts. There may be additional symptoms present as well. Children with selective mutism may engage in nonverbal forms of communication, such as nodding, gesturing, or using facial expressions to express themselves. Individuals often experience intense anxiety in social situations, particularly those involving unfamiliar people or settings. Children may actively avoid or withdraw from social interactions or situations where they are expected to speak, such as school assemblies, playdates, or public speaking events. Anxiety associated with selective mutism may manifest in physical symptoms such as stomach aches, headaches, sweating, or trembling. Treatment for selective mutism typically involves a multidisciplinary approach tailored to the individual's needs and circumstances. Behavioral interventions, such as gradual exposure and reinforcement techniques, are commonly used to help children gradually become more comfortable speaking in anxiety-provoking situations. Collaborating with educators and school personnel to create supportive accommodations and foster a positive and inclusive environment can be instrumental in supporting children with selective mutism. In some cases, medications such as selective serotonin reuptake inhibitors or SSRIs may be prescribed to help alleviate symptoms of anxiety associated with selective mutism. However, medication is typically used in conjunction with therapy and other interventions. As we conclude this discussion of selective mutism, let us recognize the importance of empathy, understanding, and early intervention in supporting individuals affected by this anxiety disorder. By raising awareness and providing appropriate support and treatment, we can help children and adults with selective mutism find their voice and thrive in social interactions.